Dr. Ryan here. I'm a board certified specialist internist. Thank you so much for joining me. We are launching a new series of videos. It's called the OSCE series. Now, OSCE stands for Observed Structured Clinical Exam. And this is an examination format that I'm sure a lot of us are familiar with. Whether you're a medical student or whether you're a registrar or doing your residency in internal medicine, this is a form of questioning that we find in examinations commonly, often in the form of some kind of clinical scenario or some kind of physical exam finding in the form of a picture or some investigation results like lumbar puncture, arterial blood gas, blood results, x-rays, CT scans, EEGs, ECGs, you name it, right? So my objective here through this OSCE series is to equip us to become familiar with this kind of questioning, as well as cover a lot of pathology in internal medicine through the series. So let's get going, guys. If you haven't yet subscribed to my channel, what are you waiting for? Alrighty, so this is our first question. A 54-year-old female presents with diplopia, which is double vision, right? So picture A shows us neutral gaze. As you can see, the iris is not really in the midline, is it? It seems to be a little adducted, both on the right and on the left, right? So that's in neutral gaze. Then when we ask her to look towards her right, we see that there's incomplete abduction of the right eye, but she can adduct the left eye, right? And when we ask her to look towards her left, we find that there's incomplete abduction on the left, but there's complete adduction on the right. Okay, so what is the diagnosis? That's the first question. Then we want the cause of the affected nerve for 3 marks, and name 6 causes of the lesion for 6 marks. Okay, so the diagnosis here is obviously a 6th nerve palsy, right? So you remember SO4, LR6, R3. The superior oblique, which intorts the eye, is taken by the 4th nerve, SO4. The lateral rectus is taken by the 6th nerve, which abducts the eye, and the rest of the extraocular eye movement is taken by the 3rd nerve. Okay, let's just put that down here. Give us the cause of the affected nerve for 3 marks, right? So here we have a handy diagram. So the 6th nerve, or the abducens nerve, right? So here we have the nucleus of the abducens nerve is sitting in the pons, right? Now we look at the tract of the nerve. What happens is it pierces the dura at the piscis apex. It goes all the way up, passes the anterior inferior cerebellar artery. Then it percolates into the cavernous sinus. It goes through the cavernous sinus. So any lesion which causes pathology at the level of the cavernous sinus can also cause 6th nerve palsy. It passes through the skull at the superior orbital fissure, and then it goes on to innervate the lateral rectus muscle, which is responsible for abduction of the eye. All right, so name 6 causes of the lesion for 6 marks. This is a common clinical scenario we encounter, right? So it can be at the level of the nucleus, in which case we're considering congenital etiology is demyelinating. So watch out for multiple sclerosis and ADEM, ischemia, neoplastic or traumatic etiologies. It could be at the level of the tract or the fascicle, so fascicular. In that way, it could be an infarct, neoplasm, demyelinating pathology or trauma. Could be at the level of the subarachnoid space, for instance, an aneurysm, especially of the anterior inferior cerebellar artery, or even the posterior cerebellar artery, right? Or posterior cerebral, right? Or rather internal carotid as well, right? Carcinomatous meningitis, inflammation following procedures and infection, or it could be at the level of the cavernous sinus. It could be a cavernous sinus thrombosis, ischemia, inflammation, or neoplasm. But a very, very common cause, guys, is raised intracranial pressure. Because of the long intracranial part of the 6th nerve, it is liable to be compressed by raised intracranial pressure, usually on the back of meningitis, especially tuberculous meningitis in our setting. All right, so my friends, the book of Psalm chapter 56 verses 3-4 declares, "Whenever I am afraid, I put my trust in you. In God, whose word I praise. In God I trust and am not afraid. What can mere mortals do to me?" If you are a wholehearted disciple of the Lord Jesus, the promise in His word is that He will never leave nor forsake you. He has your name engraved in the palm of His hand. The book of Isaiah says that, "Can a nursing mother forget the baby at her breast? Even though she may forget, I will never forget you." Right? And 2 Timothy 1:7 declares that God has not given us a spirit of fear, but one of power, love, and sound mind. Rest assured that God cares for you, He loves you, and He makes provision not just for your needs, but for your protection as well. Have a lovely day.